Hi, my name is Adam, the fertility advisor from Fertility Healthcare Consultancy based in Malaysia. And I would like to welcome all of you to my channel. So from this week onwards, I will be starting a new series of video that answers all of your questions about fertility. So you can ask me anything, anywhere from natural pregnancy all the way to reproductive genetics. So please email me your questions using the address in the description box. So over the past couple of months, I've got a lot of patients asking me about a premature ovarian failure. In fact, it's a very serious condition and it's a worrying trend that not just only Malaysian ladies are getting this, but across Asia as well. So I just thought that it's going to be good for me to do a topic specifically on this. Now, I've received 3 questions from across Malaysia, and so the first question was from Miss Chang that says, can you tell me exactly what is the main function of my ovary? I understand that it plays an important role for me to get pregnant, but what exactly is that role? Okay, so now this is a very common question that I will certainly get whenever I'm giving a talk about this topic or whenever I'm giving a consultation. So I'm just going to go into a little bit more detail about the function and why is it so important for the ovaries to work properly. So now, actually there are 2 main functions. First of all, they are responsible for producing eggs, okay, hopefully healthy ones, okay. They are also known as the oocyte, okay, and that is needed for fertilization. And they are responsible for also producing 2 other major reproductive hormones, including the estrogen as well as the progesterone. Okay, so the estrogen is very important in the regulation and the normal working order in the female reproductive system, whereas the progesterone is very important to support the pregnancy during its early stages. And now each lady will get 2 ovaries, okay? They are about 4 centimeters long, and then they lie on each side of the womb, or also known as the uterus. Alright, so under normal circumstances, your ovaries will release an egg during the midpoint of each menstrual cycle. Usually only 1 egg will be released from one of the ovary, and the 2 ovaries will take turn to release the egg. Okay, you don't know which one that is from, but these eggs need to be matured before they are being released. So before they mature, they are known as the follicles. Okay, a bit of a fancy term, follicle, but I'm sure what, at least some of you might have heard of them. Okay, so at the very beginning, when a baby girl is still in her mummy's womb, she already has 5 to 7 million follicles developing. But by the time when she's born, she only has about, let's say, 2 million left, okay, compared to 7 million before. And when she reaches puberty, which is around 12 to 13 years old, she only has around 400,000 to even like 250,000 follicles left. And can you guess, a woman's lifetime, she only ovulates about 400 to 500 eggs. Alright, so that's not a lot. So you're going to have to really work on the quality of these eggs in order to make sure that you have a good and healthy baby in the future. So now, I hope this will give you a bit of a head start into our main topic. And for the next question, we've got Miss Sim from Ipoh that asks us, can you tell me what is the definition of a premature ovarian failure? What is the difference between that, meaning ovarian failure, premature ovarian failure, and an early menopause? Okay, now a lot of these terms are used interchangeably on the website, or even the doctors might tell you that they are the same, but they are not exactly the same, friends. So you see, premature ovarian failure means the loss of a normal ovarian function before you turn 40 years old. Now, this is the most proper definition of it. Now, premature ovarian failure doesn't mean that there's no chance for you to get pregnant. You will still have your menstrual cycles, you will still have period, although sometimes they might be a little bit irregular. However, you will ovulate, okay, just maybe not every month, but you will still have a chance to get pregnant. But on the other hand, whereas for a menopause, it means that all the stock, sorry, I used the term stock in the ovary has been used up. So it means that there are no more follicles or eggs to be ovulated. So if if you would be diagnosed with an early menopause, it simply means that, yes, unfortunately, if you want to have children, then donor eggs might be your only option. But certainly, if let's say you're not the case, because previously I've got a client who's diagnosed with a premature ovarian failure, so I advised her to how to modify her lifestyle, take away all these bad habits, smoking and alcohol and all that, and then I worked on her dieting habit as well, and then yeah, after it took a little bit longer for her to get pregnant, but eventually she did, and she gave birth to a healthy baby boy. But on the other hand, I've also got another client who was diagnosed with, an early menopause. Later on, I'll share with you how do you diagnose an early menopause. So we had a discussion right here, right in this room, and then we talked about using donor eggs, we've talked about foster care and all that kind of options. Alright, so if you're being diagnosed with premature ovarian failure, don't lose hope, you still have a chance to get pregnant. Alright, so I have got another question over here from Miss Slim. So she asked, I knew that I'm born with all the eggs that I will ever ovulate. Yeah, that's right. But how do I know how much eggs do I still have? Alright, this is an excellent question. Well, there's one very specific test that you can do, and it is just designed to see how much of the eggs that are left in the ovary, and that's called the anti-Müllerian hormone, or AMH in short. Actually, this hormone is secreted by the follicles in your ovary. So the higher the AMH, it means the higher the reserve that you have. But I also want you to know that as you age, you'll be using more eggs, right? So AMH will drop. So you should go by the age when measuring the AMH level, alright? So AMH dropping according to your age is perfectly normal. Once again, I have to emphasize that because a lot of my clients, they're being confused, and even some laboratories, when the reports are produced, it will look confusing. So I came across a client here who's 40 plus years old, all right, and then her AMH level was comparable to those of 30 in their 30s. Now this is really not good. Why? Because a lot of people thought that the more AMH that they have, the better it is. No, have you ever thought of why do you still have so much of these eggs left? Okay, so you see, the problem is that she's having PCOS, judging by the result of a report. Okay, PCOS means polycystic ovarian syndrome, meaning that you're not ovulating each month, alright? And then not ovulating, why is that? There's a lot of reason, alright? But then you see, if you're not ovulating, then how is it possible for you to conceive? Not really, right? So then, based on that, I referred her to one of our panel gynecologists, and we got that treated. So I still advised her to live a healthy lifestyle, still advised her to, eat healthily, and then eventually, within 6 months, she got pregnant. So you see, everything has to be just right in order to conceive. So I don't want you to get disappointed after you try for a baby after a year later on, and then if you're not successful, you start to doubt yourself or whether I'm sterile or something like that. No, you're not. In fact, let me say something encouraging to all of you people. So in the world, actually there's only 2 to 4% that are total infertile, meaning that they don't have a chance to get pregnant naturally. Alright? But still, even for these people, through assisted reproductive treatment like IVF or IUI, they still get a chance to get pregnant. So as you can see, the people in this world that has no chance at all to get pregnant is really, really less than you think. Alright, so I hope through today's video it actually answered some of the questions that you want to ask. Please stay tuned for next week because we do have another video coming. Don't forget to click like for this video to support us and to subscribe to our channel to get the latest news about fertility. Thank you so much.